Hi, everybody. We've got some problems here today. Give me just a moment, please. I am having some issues. It looks like Dr. Steffins is having problems with technology. Something is going on. She's not able to log on yet. We're going to give her a couple minutes, but if she can't get on, we're going to have to reschedule. But I want to just kind of give you guys a little bit of an idea about why this is so important and why I wanted to bring brain mapping to you. But so give me just a minute, you guys. I'm going to give her probably 5 more minutes, and then I'm gonna call it and reschedule it. But in the meantime, we're recording, and I'm actually going to open up and put this into the Clarity group. Hold on a moment, guys. Actually, you know what? We'll go live on my personal page because that's where we were going to share all this information anyway as a follow-up to the neurofeedback. So thank you for your patience. We're going to give her time to respond and see if she's going to be able to rectify the issue. Hold on a moment. Okay. Yeah, it's not going to let me do that either. Okay. All right. So let me just talk to you guys for just a couple minutes, and we'll give her time. And if she can't get on, we'll do a replay and I'll send out the link. But one of the things, and put your questions in the chat if you have any questions at all about why I'm bringing brain issues and brain topics and all of that to you guys. It's really because of, the things that we are working on as far as health coaches are concerned is helping people with all of these aspects of health that have to do with food, detoxing, cleansing the liver, hormones, and all of that. And so many times I really have felt over the years as a health coach for almost 10 years now, that there's got to be so much more to this, right? So when I started the Institute for Functional Health Coaching, I started with 5 essentials, the food, movement, sleep, things like that are so obvious that we've been working on. And over time, I realized that so many of my clients were actually getting really great results, but there was just some pieces missing from finding that optimal place for their health and how they, could really feel good in their skin. They could sleep well. They could have good relationships and things like that. And I thought, where am I missing on this? Like, where am I missing? What's the missing piece in my health coaching business that would make sense, to dig deeper into? And so I thought, well, this is kind of stupid and really so obvious at the same time. Why are we not looking at the brain? Why are we not talking about what's happening in our brains? Our brain is not separate from the body. Our clients' brains are not separate from their body. So much of what happens to someone's physical body has to do with how we think, has to do with the health of our brain, has to do with the things that we've experienced and been through in our lives. And so that's when I really started digging in for my own personal self, is digging into how can I learn more about how my brain is functioning and how I'm being affected by the things that maybe I haven't dealt with in my life, or the things that I'm eating, or the way that I'm thinking about my life. And so I did a really deep dive into reading the book by Datis Karazian a long time ago about the brain. And I think it's called, I'd have to even pull it up, but I think it's called Why Isn't My Brain Working? Someone on here may know. And hold on a second. Yeah, I'm getting messages from her team right now. But anyway, there's a book about the brain out there by Datis Karazian. He wrote the book about thyroid. So for those of you who remember him, he's kind of the pioneer of why do I still have thyroid symptoms if all my lab tests are normal? Well, he wrote this ginormous book. It's over 500 pages about the brain. And as I was reading this book, it's very medical. It's very, it's one of those books you really got to sit down. You can't be doing anything else while you're reading it. And I started losing my focus and my concentration. And I thought, why can't I even focus on this? Usually I'm pretty good. Yeah. So Gail, do you mind putting the name of that in the chat for me so I can stay focused here as we're talking about focus and how I lost my focus? But so I was digging deeper into it and reading more about it, but I was losing my focus and kind of going off in other areas while I was reading it. And I thought, this has to be indicative of something else going on with my brain, right? And so what I decided to do after that was to look even more into nutrition and the things that are affecting us, fatty acids and all of those things. How is the brain made, and so on and so forth. Well, even with learning more, changing up my food, adding in, taking out supplements, making changes for myself, I still felt like something's missing, right? And so then I started studying trauma, and this has been a couple of years ago. And for those of you who know, or are students or members of the mentorship group, you know that I added trauma into the Institute's Foundations for Health when we opened the doors last year. But I didn't just say, oh, let's talk about trauma. Let's put that in as a foundation. I decided a long time ago, many years ago, that this was a really, really big thing that so many people are not focusing on or facing for themselves. And I wanted to know, how can we go about dealing with this? So I went out and I did I did some EMDR. I did brain spotting many times, many different EMDR therapists, cognitive behavior therapy, of course, tapping, all of those things that health coaches are probably pretty aware of that, can kind of alter our brain physiology and the way that we think about what's happening to us. So even beyond that, I still was saying, there's still something more and something deeper. And then I was introduced to neurofeedback and brain imaging and brain mapping. So give me 1 second and I'll give you a briefing on that. And yeah, I'm not seeing it. Okay. It doesn't look like she's going to be able to get on. We're going to have to reschedule. And so yeah, I don't know what's happened, but something's happened, but that's okay. That's okay. We can reschedule. It's not a big deal. So let me give you just a little bit of a rundown about what it means, what brain mapping is, what the QEEG is. And of course, we would love to have a doctor on here that is a specialist in this, because she is an expert. She's a psychotherapist, and this is what she does for a living. But the QEEG is originally designed for brain research, and it can be called brain mapping or brain imaging. And basically what it does, hold on, I'm scrolling up here. So it enables the physician or the practitioner to see the unique pattern of mental strength and illness and weaknesses, areas of the brain where there's too little or too much activity, areas that are not coordinating their activity the best that they could. So using the QEEG for initial assessment, this kind of designs that neurofeedback program. So many weeks ago, if you haven't seen it, you guys, you need to see the neurofeedback webinar I did with KK Ray. It's fascinating. So many people are even coming into town to actually do the neurofeedback in Nashville with her and her organization, because it was that impressive. But anyway, so what happens is they use this brain map and they go in and they design what the neurofeedback session will do. Because when you're gathering that data, it tells where those weaknesses are again. And so when the neurofeedback is done, it goes after those areas of weakness, and really just helps to kind of, as we know, the brain is neuroplastic, helps to rewire the brain and helps to make changes. So we've mentioned this before in the neurofeedback webinar. And for those of you who have just gotten on, Dr. Steffins had problems getting on with us today. I'm not sure what happened, but we're going to have to reschedule. But I'm just kind of running down what we were going to talk about. So stay if you want. If not, that's okay. Yeah, and Simone saying I'm obsessed with the brain. Yeah. So basically what we were talking about with the neurofeedback. So brain mapping kind of tells us what's happening inside the brain. Where are our weaknesses? Where are we losing our power? Where do we need to improve things? And then the neurofeedback comes in behind it kind of as a program that helps to rewire those neural pathways. So it looks like, for example, and I use the cart and horse analogy all the time, where, the farmer's going out to the field every day with a cart and some horses, and those carts are digging those deep grooves down in the dirt on the way to the same farm or to the same land every day, right? So the horses know the way, the cart and the wheels fit nicely in. But after time, that can become really difficult to drive down or ride down, so to speak. The wheels can get stuck. It can go so deep that they don't move. Well, that's the same thing with the patterns in our brain. When we are, when we're addicted to things, or we're making bad decisions, or we can't shake something that is going on with us, we can't overcome obstacles or challenges, it's because we have developed this same pathway habit every single day. So neurofeedback, what it does is it goes in and helps us to take that cart off that trail, so to speak, and develop new neural pathways so that we can think differently. And that really affects what happens with us when it comes to trauma and it comes to performance. And it is not just only for performance, you guys. I mean, trauma is for performance as well. Can really make a huge difference in how people perform at work, how athletes perform. I believe it was the Navy SEALs that they've used this on, or the Marines. I think it was the Navy SEALs, and shown significant improvement. It has been amazing for our veterans and PTSD. So the mapping is very important, because what it does is it shows us what's going on before we actually jump into the therapy for this. And then afterwards, when you map again, you can see how much different your brain is and how much things have changed. So I've done this whole entire process. Did the brain mapping. Oh gosh, I want to say it was last year sometime, last fall, 2017. I had absolutely very little power. My brain was functioning on hardly any energy whatsoever. And in fact, when the brain mapping was read to me, they were able to really tell me exactly what was going on in my life at the time, where my stress was, where how I was sleeping, whether or not I had anxiety, whether or not I was finding joy. It was unbelievable. And then I actually I did 20, I want to say 25 or 26 neurofeedback sessions, and we remapped it recently. And it's unbelievable, the changes and the shifts in my brain, especially the fact that I can actually take that map and I can match it to how I've changed and how I feel now. So it's been a significant change over time. But one of the biggest things that happened was I removed a very, very big stressor from my life. And so we mapped it after these big changes happened. It was 6 months or 7 months after the changes, and it combined with the neurofeedback. So it's been, I want to say, we like to say curative. I don't like to say the word cure, but it's been curative therapy for me and the things that I've been trying to work on for my own self and working through traumas and trying to change the way that I think. So, here's what I have to say about it. It's one of those things when you go out and look for brain mapping and you look for neurofeedback, not every brain mapping place or neurofeedback place is the same. Okay. They're not all the same. So you want to be, and I'm not going to tell you what to look for because I don't know those guidelines and parameters, is what we're going to ask Dr. Steffins about. But I want to say, like, just because there's someone in your area that does neurofeedback or brain mapping, don't just automatically think that it is the Cadillac of them. We want to make sure that you're going to someone that is doing this the right way. And so with that said, we will save those questions for Dr. Steffins and we will reschedule. But I want to look in the chat and see if anybody, has anybody on here actually ever done neurofeedback or brain mapping? Okay, yeah, thank you so much, Gail. Oh, I got it right. My brain must be working today. Why isn't my brain working? By Datis Karazian. So it's Datis, and then I always get the spelling wrong on his name, but I think that's correct. Amazing book. I had to do it reading and I had to do it on Audible because it was at the time just way overwhelming for me, way overwhelming. So, yeah. And Simone says, I'm obsessed with The Brain for Personal Reasons. KK Ray, that's okay. She blew my head. I feel like I need to see her and I will. I'm so glad you're chatting, even though it's postponed. Yes. And so let me say this too. Yeah. Yeah. Look at us all trying to type Karazian. Yeah. So let me say this too. One of the things that I've really noticed over the time that I've been doing this is that there was some times in my life where I felt like I was so stuck in my patterns, like my thought patterns were so stuck and I didn't know how to change them. You can do all the affirmations in the world. You can talk positively to yourself. You can do cognitive behavior therapy. I've done so much therapy over the years over so many different things. And I have absolutely no problem sharing this information. I think everyone needs to work on themselves forever because we all have things that we need to work on. But I had done so much and I was getting to the point of frustration when I contacted KK, and I remember saying to her in roundabout way, I said, I'm basically a therapy hopper. I've really not been in a therapy session where I really felt like I got significant success or change. So I don't know. We'll see what happens. I'll see if you're a match for me. And she said, oh, I think you've met your match. And I think we've got something, that's going to really change things for you. And I'm like, okay, whatever. Well, let me tell you this, the first session I had with her and then moving into the brain spotting right after the mapping, I've said this before and I'll say it again. I really felt like my feet weren't even touching the ground. I felt like I had no weight in my body at all. I cannot explain it. Cheryl, the name of the book is at the top. Why Isn't My Brain Working is what it's called. But I remember almost floating over, like just walking out, feeling like my feet weren't touching. And I was very present in my body. It wasn't like I was having some out of body experience or anything crazy like that. I felt like a weight had been lifted off my shoulders and I could feel the change. And that night, I've never slept so hard in my entire life. I slept like a rock. I slept like 7 or 8 hours straight without even moving, which was unheard of at the time for me. Sleep disturbance in and out was one of my complaints. So I can tell you from experience and from studying this and learning about it, interviewing KK, that this actually works. Hi, Jane. Yeah, Dr. Steffins did not show up. She had some technology issues, so we're going to reschedule. I'm just talking a little bit about neurofeedback and brain mapping and why I really feel passionate about this topic. It's not often that, in fact, I don't think I've ever had an expert not able to get on. So there must have been some major glitch for her. So let me go and tell you guys a little bit about why it is. And I'm reading from something on a website here, because I don't know enough about this stuff to tell you guys all of the great details here. But, it says being able to process the brain map on the spot has real advantages, because, there's times when people don't believe that there's anything really wrong. They think they can talk their way out of something or read a book and it's going to change everything. And, it can be really helpful to see, just like with labs when we work with our clients, it can really be helpful to see that there is something going on. It's almost like proof. When you see that your brain is working on such low power, it's almost proof that, yes, something's happening here. And it can also, it can cause a little bit of anxiety for some people. Not for me. I was like, yes, absolutely. This shows everything that's happening for me. I'm actually excited about having a solution or a curative plan for moving through this. So, it's one of those things. If someone says, well, I don't think I have a problem with sugar, and then they get an HbA1c back of like 6.5 or something crazy like that, you're like, well, I think you might have a problem, right? Okay, so an EEG actually uses surface sensors to detect the brain's electrical patterns, also known as brain waves. Common brain imaging techniques like MRIs, CAT scans, and X-rays are built to measure brain structure. And EEG, or brain mapping and imaging, measures both brain activity and function, how you're feeling moment to moment. And if I'm not mistaken, you guys, this is also approved by the FDA. So this is just as powerful and credible as an MRI or a CAT scan. Okay. When you get your EEG, it's painless. You don't feel anything. It's just like this little cap that goes on your head, and you don't feel any electrical anything. It's just, you sit there and I think it's 10 minutes with your eyes open and then 10 minutes with your eyes closed, and it reads what's happening in the brain. So it's really, really cool. All right. So with that said, I'm going to do one more check and make sure we're not going to be she's not going to be able to hop on. And then we're going to have to announce a reschedule. So let me just make sure, you guys. Does anybody have questions? No one's ever done this before? Am I the only one that's ever done brain mapping and neurofeedback? Oh, there she is. Oh my gosh, she's here. Hi. Oh my goodness. Okay. Hey, we can't hear you. Hold on, you guys.
Can you hear me okay? I have to apologize.
Okay, I can't hear anything you're saying. Look in the lower left-hand side.
Okay.
Where the mute button is, it's going up and down.
Okay.
And click that.
Okay.
I cannot hear her. Linda, you can hear her? I cannot hear a thing.
I can hear you.
Everybody can hear her but me.
Oh, okay.
Hang on a minute. Okay. Are you there?
I can hear you.
Okay, good. I can hear you good. Okay, I had to turn it. Yeah, I had to have the volume. We missed you.
Horrible technology issues between here and Tennessee and all that. I sincerely apologize.
That's okay. That's okay. We've got kind of a fuzzy signal on your end too. It looks like you've got a really low signal, which might cause a little bit of delay, but that's okay. We're going to go ahead and let's just jump right in. I'm going to introduce you. I've been talking a little bit about my experience with brain mapping and neurofeedback, and reading from a website really a little bit about what it really is, but I'm so happy that you're here. So let's do a proper introduction. Dr. Steffins has earned a doctoral degree in psychology with a specialization in psychophysiology. She is the owner and founder of 3 neurofeedback clinics in New York and has practiced for approximately 15 years. She has been internationally board certified in psychophysiology for 10 years and achieved the title of fellow. She is recognized as a certified mentor in the field. She is an active board member on several organizations, including the SE Clinical Neuroscience Association, in which she is the chair. She's an active member of the New York State Drug Court Professionals and has recently accepted the position as clinical director for 2 clinics in Tennessee. And we're so glad you have at the clinic that I go to as well. So happy to have you. Yes. Okay.
Thank you so much.
I've been talking, so it's your turn.
Okay. What would you like me to start with? I mean, the brain mapping part of it?
Let's talk a little bit about the history of brain mapping. Can you tell us about the history of it, what it is, and then lead into how you discovered what it does for us?
Okay. So the brain mapping is clinically called a quantitative EEG, and it's actually a record of the brain's electrophysiology, which is all of the electrical activity that's going on in the brain. So we have about a couple of million neurons in our brain, and they all have these little arms protrude from the neuron that carry the electrical message from neuron to neuron. And so there's about 3 trillion of those connections. What we're doing is actually eavesdropping on the brain's electrophysiology. The original QEEG, or quantitative encephalograph, was designed by a Harvard researcher, Dr. Frank Duffy, in the 1950s. So that's when we first started mapping out the brain. Although we first had a German physician back in the 1800s, the late 1800s, was the first person to record a brainwave frequency. So it took that bit of time in order to understand enough about the brain's electrical activity to be able to develop devices that we could measure, separate the electrical activity into some kind of a map so we can see what's going on. And then it also took a long time to develop a database. You know, what do we consider normal functioning? So if we compare somebody's brain activity to this norm, we need to have a body of what we know is norm in order to compare it. And what it does is it helps us to identify where what we call dysregulation is in the brain. And based on the areas
Hang on, we're freezing up.
we can kind of correlate that to a symptom. Okay.
Yeah, you're frozen. Yep, you're freezing up, and we've got a lot of noise in the background too. I'm not sure what's happening.
Is there a way we can call in with the phone instead of using we can use the picture, but maybe use the... You can,
yeah, if you want to call in, you've got the panelist link. It should tell you how to join by phone or by, it might be easier for you. And then we could have we could hear more clearly for sure.
Okay.
Yeah, be patient with this, you guys. We're working on it. It's technology. And I know many of you do these types of things too. And we definitely, we deal with, that's what the world we're living in right now. Yeah, okay. So you'll probably have to log off here and then just call in.
Oh, we can't leave both of them up?
I can't hear you.
Can you hear now?
I can hear you. Yeah.
I'm trying to call in.
Yeah, go ahead and just call in and disconnect from here because it's not working. The signal's red. But you'll want to disconnect because otherwise we're going to get a lot of feedback.
Okay.
Enter 669774223T. This meeting ID does not exist. Please re-enter your meeting.
Okay, hang on, you guys. Let's try this again. Oh, yeah. It's okay if she didn't keep video. I mean, it's fine. It's fine. I want to be able to hear. I can't, the background, like noise and background noises and that kind of thing, and the signal going in and out. That's just one of those things I can't focus very well when that happens. I don't know about you guys, but I'd rather be able to clearly hear. And are you there?
Yeah, how's that? Is that a little better?
Oh my gosh, it's so much better. Yes, perfect.
Okay.
Yeah.
All right, super.
It's a little bit muffled. It's a little muffled, but at least there's no background noise, and you've got a good signal.
That. Okay. So so when we can map out the brain, we can actually find the specific area that's dysregulated and then correlate that to whatever symptoms are evident there. So now at this point in time, we've actually uncovered hundreds of different patterns in brain functioning that correlate with anything from anxiety, depression, to autism, to attention deficit. So by mapping out the brain, we can actually see things that typical mental health practitioners can't. And what really brought me to the field and really piqued my interest was the fact that mental health is the only healthcare field that doesn't look at the organ it treats. So we can have somebody go to a physician and give a description of their symptoms, and without ever looking in the brain, we can say, well, you have anxiety or you have depression. So that really was a red flag for me. And it says it's really that important to actually look at the brain and see what's going on before we develop any treatment plan. Does that help understand the mapping part of it?
Yes, and I was talking about that earlier too, is that I can verify that that is true. I mean, my symptoms matched my map, I mean, almost exactly both times, as you know, because you did my reading. So yeah, fascinating.
Right. And one of the things that we find happen often is that symptoms are consistent with a few different pathologies. For example, if we have someone who has severe anxiety, it's the same symptom as having a hyperactive thyroid. If we have a child that has attention issues and it's showing all of the things that we would say correlate with that diagnosis, we see the same symptoms for someone, child who has domestic violence at home. Or if there's drug addiction in the home, that child's in a classroom and they can't pay attention, they can't be focused, they can't sit in their chair because they're either so anxious about what's going on after school. So we tend to look at those symptoms and treat the child with, say, a Ritalin, whereas they really don't have that diagnosis. So that particular situation, there's about 85% of children that come into our clinics that are diagnosed with ADD and are taking an ADHD type of medication that actually don't have what the science tells us as far as the brain physiology that's equivalent to ADD or ADHD.
Wow.
So
that's so sad.
It is. And, you know, today we have about 4 million children on ADHD medications. And what we know from brain science is that there's only about 3 to 5% of the population actually has an attention deficit.
That is crazy. So, oh my God. Have they done this with adults as well?
Yes. I don't know the exact statistics. Most of the ADHD diagnoses are on children. Right. Because many times by the time adulthood happens, people have learned coping techniques and strategies, and at the adults were not exposed to the diagnosis. Like, so when a 50-year-old was 10 or 12 years old, we really didn't know so much about ADD or ADHD. So most of the diagnosis is with children. So that same scenario is in many other diagnoses also. So, for example, the symptoms that are associated with depression are similar to someone that may have trouble processing sugars, maybe low blood sugar. We're going to see the exact same symptoms, but it's coming from a different origin. So wow. with psychophysiology, what we're really concerned is what is the origin? What's the reason the symptoms are happening, so we can address that rather than just addressing the symptoms. So typically in Western medicine, we're trained to address a symptom. So if somebody comes in with a migraine headache, we know the exact thing that can help with that migraine headache. But in psychophysiology, or as well as in functional medicine, we want to look at what's causing those headaches every day. We have enough information on how to treat the headache, but why is the headache happening? Mm-hmm. So it's about going to the core of the dysregulation and addressing that.
Yeah, I love that. Yeah, I love that, because that's what I teach at the Institute for Functional Health Coaching is, you can come to us with all of these diagnoses and these symptoms, but how can we get to the bottom of the problem? How can we figure out where this came from? What's triggered the problem? Because Band-Aids don't work. We want sustainable, mm-hmm. long-term, health and optimal living for these people. So I love that. I love it. So yeah. Can you tell me, remind me, and I said this earlier, I think that KK had said that brain mapping is FDA approved. Is that correct?
The quantitative EEG was approved in 2013 as the only definitive assessment for ADD or ADHD.
Okay.
We're still working on them recognizing it as a diagnostic tool for other disorders. One of the limitations is the amount of funding. So a lot of money is put into pharmaceutical research. So we're reaching a point in society now where people are really starting to lean more toward natural type of remedies. And a lot of people are getting tired of side effects or being, kind of chained to a medication that they have to take the rest of their lives. So we're starting to see a lot more money being pumped into other fields, other complementary alternative medicines. So hopefully at some point in the near future, we'll be able to use these as a diagnostic. So the difference too is with psychophysiology, we don't really use diagnostic terms the way psychiatry and psychology would, because it really doesn't matter what the label you put on my symptoms are. We just want to know what's causing those symptoms. So what we're doing with the quantitative EEG or the brain map is diagnosing brain functioning and then using neurofeedback to regulate that.
Okay.
So it's a little bit of a different perspective.
Yeah, I agree. I remember when I started seeing KK, and I would be talking, and I've said earlier on, I'm like, oh, I have done therapy for years, and I've done all these different kinds of things. And so when she and I would have a conversation, it maybe one little bit of a level up on when it comes to terminology. And she was like, yeah, we don't use those terms. We don't use those. We don't diagnose people with those things. And I thought that was fascinating. That you don't use, the antisocial disorders and narcissistic disorders.
Right.
And, very fascinating.
Well, what too with that, Carmen, just to add on to that is the label, and particularly with children.
Yes.
You don't know how many kids come in and say, honey, you have to, sit still, or you can't jump in on the couch in the waiting room, and they're like, well, I have ADD, or I have bipolar. So it's really, the label is not only just, putting a name to the symptoms, but we're also using that as an identification for kids. And that could be just as damaging as somebody being labeled the bad kid,
Yes.
So they think something's wrong with them and they're not normal, or it's an excuse for the behavior. So I don't have to pay attention because I have ADD. So we don't want to give people excuses. We want to teach them how that they could, self-regulate.
Yes.
And that's more important than the name to the symptoms. And a lot of times in the way the medical field is set up, we need a diagnosis in order to get certain accommodations for children in school, so they need a label. But I just don't see labels as being, effective at all. And I think that sometimes they're more damaging to people.
Yeah, I would agree with that. So since you said earlier that it's approved for a diagnostic tool for children with ADD and ADHD, why is it, in maybe you have the answer to this or not, but why do we not hear more about this as something that is, being provided to families with children that are struggling with this? And because if it's approved and it's non-invasive and it can prevent so many, side effects from medication and things like that, and let's not even talk about all the IEPs and the things that are going on in the school that children are going through. Right? I mean, that's money that people are spending and staff and all of that. So why are they not using this?
Because we tend to lean toward the Western medicine perspective, and that's really all we know today. So parents, when you have something, you go to a doctor. A doctor is trained for addressing symptoms. And a lot of medical doctors don't have training in complementary alternative medicine. And it's not a bad thing. It's just what we choose to seek help from. So, for example, if I have an issue, I go to a medical doctor, he's going to treat the symptoms. If I go to a surgeon, he's going to take something out. So it's just a different perspective on what those professionals study. So if you go to a naturopathic doctor, they're going to address that same thing with something natural.
Right.
So the general public doesn't know of these things because for years and historically we've been told about pharmaceuticals and the pharmaceutical industry. And don't get me wrong, there's a place for it. I don't mean to say anything bad about it, but we're so pharmaceutical driven. All of the money is in pharmaceutical research. So we know a lot about it. But like I said earlier, society is starting to shift to a more natural approach. We're seeing a lot more interest in yoga and meditation and self-healing and prayer, you know, all these things that we know are effective and just as effective. We just don't have the money for research like we did with pharmaceuticals.
Right. Unfortunately. Yeah. So can we talk a little bit about veterans? I want to talk about veterans. I live in a military town and, you know, we hear all the time about PTSD and how our veterans are suffering. And I'd like to know if there has been a study done with brain mapping for veterans and then, you know, put them through the neurofeedback and then gone back and remapped again. And can you talk a little bit about anything that you might know about that?
Yeah, actually, the United States military does use neurofeedback for veterans with post-traumatic stress disorder as well as traumatic brain injury. What we know is that even any soldier that is within 5 miles of an explosion has some type of injury to their brain because of the impact that it has. So the first one was on Camp Lejeune in the United States Marine Base, and they are using neurofeedback for veterans there. The unfortunate part is if you don't live in North Carolina, most of these veterans can't get the service because it's not recognized by, you know, the veteran administration in other areas. Our clinics are part of the Wounded Warriors program, so we provide pro bono services to veterans just as a way of saying thank you for their service. So we try to carry at least 3 cases at a time, and that usually allows them 2 brain maps and 40 sessions of neurofeedback.
Wow.
But it's unfortunate that, you know, how many of them can we carry? So we make sure that we at least have 3 of them. Back in the 1950s, 1960s, the Menninger Clinic, what they found was a high correlation between alcoholism, traumatic brain injury, and veterans. So they did research there that was really profound, and they had veterans that were they were unable to just do their daily functioning. They needed help with that. And after neurofeedback, the neurofeedback program, there was about 85% of those veterans remained stable and didn't need the assistance that they needed before. So again, the unfortunate part is it all boils down to funding. You know, we need funding to get these programs into other areas. And I've done a ton of work here in New York addressing the Veteran Administration, and, you know, you only get so far, you know, and there's just a red tape, you know, that you have to go through. And most of us in psychophysiology, we're smaller clinics. So we need to tend to the clinics, and we don't have, you know, lobbyists going out and doing these things. And again, you need money to hire the lobbyists.
Right.
So it's a catch-22, you know.
Yeah. You'd think that we would be able to better care for them, for our veterans. You'd think that would be a priority, but unfortunately, it's not.
Exactly. But it's even true with regular medical care too, you know.
Yeah, that's true.
Just the other day, I had a veteran that I've been treating in the Wounded Warriors program that called from the veteran office, and they were kind of questioning his diagnosis of PTSD, and he was in combat for almost 5 years, you know, in Iran. And I was just so, it was heartwarming. I actually talked to the gentleman that was working on his claim, and I sent him a copy of his clinical map, you know, the QEEG, and they were so impressed by that they actually approved his claim for combat PTSD.
Wow.
But without that, without that tool, they were challenging that. So the QEEG was able to get this veteran the services that he needed, you know, but without that, he would have been hanging in that limbo for a while.
Yeah. Think of how many are out there doing that are hanging in limbo for right now.
Right.
I actually had a veteran about 6 years ago that was a client, and you know, he had multiple diagnoses, and you know, the best I could do was what I could do with my scope of practice, but he was just on the he struggled for 5 years to get medical coverage, and it's just I mean, sitting with him was just terribly sad. Yeah, it was terribly sad, but we've got some questions. Yeah, go ahead.
But just want to have to thank you for this avenue to get this information out, because the more of us that are spreading the word, and more of us to have that ripple effect into our own communities where we can make people more aware of it. And there are, you know, we're out there. It's just a very small field. Yeah. So people don't know about it. When they find out about it, then they can go on the computer and say, hey, there's somebody right in this town that I never knew existed.
Yeah.
So so I compliment you on helping to get this out, and I appreciate that.
Absolutely.
So if we can all go back to our own little circles and start, you know, talking about it, and it just gives people more tools in their toolbox. Maybe medicine's not working. Maybe therapy's not working for them. And this may be something that could be life-changing for them.
Absolutely. I know it has been for me. I told my story a little bit before we got started, so I won't repeat, but it absolutely has. And I've been the person that's done the you know, the cognitive behavioral therapy. I've done the brain spotting, the EMDR, all of those things. And I'm like, and I told KK, I'm like, I don't know if you're going to be my match or if I've met my match or what. And I absolutely had. But okay, so we've got some questions here. Andre is asking, and I'll just answer this real quickly, is brain spotting a part of brain mapping? And no, Andre, it's not. Brain spotting is a technique that is very similar to EMDR. And if you go back and look at the webinar with KK Ray, actually, we talked about that kind of extensively in there, and I've talked about it in some of our student calls too. And I'm happy to talk more about it on our next live if you want to know more about it. But Linda is asking, can you give a general idea of how many feedback databases are out there? For example, if I was to come and do some sessions, I don't live in the area, but then needed to finish up closer to come, what is the likelihood of finding someone who uses the same database? I know you can't predict who uses what, but do you have an idea about this?
Okay, so what I can answer is there's only about 700 board certified providers in the United States. There's about 1,500 internationally. So they're very hard to find. But if you look on there's a website, it's the BCIA, which is the Biofeedback Certification International Alliance. And if you go on that, it's a bcia.org, and you can search for a provider. It allows you to search with up to a 50-mile radius. So you can hopefully find someone, but it is in certain areas, it's very difficult to find a practitioner. The typical neurofeedback program is between 40 to 60 sessions, and that's based on what science tells us is enough to address most common concerns. So if we have somebody with a real traumatic brain injury or, you know, some complex PTSD, it may be a little bit more than the 60 sessions. I find that children who are adopted or were in the foster care system have a lot of dysregulation because of not only physical damage that's common with those situations, but emotional damage, toxins, medications that they're on. So a lot of them need a lot more than the 60 sessions, but on average, it's about 40 to 60 sessions. If you find somebody that you can travel to, the science recommendation is you can do intensive type of training, and it's usually about 2. You can push it to 3 a day, but there needs to be about two hours in between each session. So there are people that fly in and visit a clinic and stay for a week and get as many of those sessions in as possible. And then at another point in time, come back and do more of those sessions. Yeah. So if you can't find somebody, I'm sure that there's other clinics that would do that intensive training.
Yeah, yeah, and just for those of you that were with me with KK Ray in Nashville, from the Nashville Tennessee Neurofeedback, that's 45 minutes to an hour and 10, depending on our I-24 situation here. Interstate 24 is famous around here for accidents, but we've had multiple people coming in from all over the country to do intensives at her office since we did that webinar, and so she absolutely is a resource for that. I actually ran into one of my students from the webinar. She was in town and I was coming out from a neurofeedback session, Dr. Steffins. I think it might've been the day that we did my mapping, and she was sitting out in the lobby. It was crazy because she was like, Carmen, and I'm like, oh my gosh, funny we were there at exactly the same time. But just as a personal note, if anyone does come to Tennessee to do this, you guys tag me and get with me and let me come up and meet you. I would love to meet some of my students and people that are following us. Okay, so Linda is also asking, would a QEEG most likely not be covered by insurance if it's not a screening tool for ADD or ADHD? I was going to ask that too. So if someone had a diagnosis of anxiety or depression, for example, has this been seen to be covered by insurance for a QEEG?
Yes, what we're finding is that most insurance companies do cover the quantitative EEG, and it's under the medical policy. So they don't usually ask for a diagnosis because this is to understand brain functioning in order for, say, a provider to make a diagnosis. So most of them do cover it. The problem is when you're going to do the neurofeedback training sessions, that is under the behavioral health part of your insurance. Mm-hmm. And that's kind of, I would say, about 60-40, where about 40% of people are getting reimbursed for it. Now, the good news is when I started my clinic 15 years ago, nobody was getting reimbursed for anything, not the QEEG and not the sessions. So to find now that most of them are covering the EEG and a good portion of them are covering the training sessions is really, I'm really happy about that.
Yeah, none of mine was covered. I've always paid for everything out of pocket, and we don't have very great insurance for behavioral health or any of this stuff. So, okay. So
Carmen, is it okay if I throw some codes out there for those that are listening? If they wanted to, if you wanted to call your customer service numbers on the back of your insurance cards, you would ask for the medical policy, and the CPT, which is the insurance reimbursement codes for the quantitative EEG, is 95957. So you would call them and say, I want to get this assessment. This is the CPT code. Do you cover, and how much do you cover?
Okay.
So there are some insurance companies that cover the whole amount. It's based on how the insurance is written. Some people need to meet a deductible, some don't, so everybody's is different, but that's the code you can use.
Okay,
if you're looking for reimbursement for the neurofeedback training sessions, you'll have to call the behavioral health insurance. So it's different than the medical. And that code, the CPT code for that is 90901.
Okay, 90901. There.
Yeah, you just call and say, I need to want to go for these sessions. Do you cover this, and how much?
Perfect. Okay, I put those in the chat, Medicare, you guys. Yep.
Medicare covers nicely. So anybody in that 65 or older, or anybody that has longer than 2-year disability is eligible for Medicare. And they don't usually ask questions. They just do their reimbursement.
Wow, nice. That's nice to know, huh?
Yeah, it is. It is.
Golly, okay. So anyone that's listening, or you guys, I put the codes and the explanation on what to ask for in the chat. So thank you for whoever it was. I can't remember who told me about how to save the chat, but go down to your lower right-hand corner. You can either write these down or you can save the chat. It says more, the drop down. I think it was actually Solange that told us this. And so you can save the chat. So if you guys want any of the notes from the chat, go down and do that now. Okay, so Linda, she's my question girl. Like, she always has so many great questions whenever we do webinars. She's asking, can you please explain the details of the actual neurofeedback part of this process? Is it frequencies being directed towards the brain, or how does it work to retrain the brain?
It's based on what's called operant conditioning. If those of you out there remember Ivan Pavlov's work with his dogs and the bell. So what we're doing is pairing some kind of a stimuli to a behavior. So when we're looking at neurofeedback, we're looking at brain behavior. So if we identify a frequency that is not sufficient, so say if one of the alpha frequencies, the brain is not producing enough of it, we're going to train the brain to produce more of it. Anytime we get that brain to produce more of it, it's paired with a bell or a beep. And so the brain learns through that association on a cellular level. It's not on a conscious level, but it learns by that beep, by pairing the beep with a brain behavior. And the repetitiveness of it helps create a brand new neuron. Just the same as if we were to work on our biceps and we were going to do 10 reps at 20 pounds. The repetitiveness of that is going to build muscle mass. So the repetitiveness of the neurofeedback training actually creates a brand new neuron, and it's called neurogenesis. And that's why we need about 40 to 60 sessions on average to actually build those new neurons, because the repetitiveness is what's important.
Okay. So I hear those things going off like crazy when I'm getting my session.
Yeah, that's good.
I mean, they don't stop. And I've had to start even, because I can fall asleep within about 2 to 3 minutes of starting my sessions, even with those dingings. And the other day, it was like one after the other, over and over and over again. I have never heard them that consistent before with that many. And is that a good thing?
It means that your brain is meeting the goal.
Oh, okay. I do love a reward every now and then.
Yes, of course.
Oh my goodness.
So that beep will only happen if your brain is meeting the goals that we set for it.
Oh, okay. Well, I feel accomplished now. Maybe that's why I feel so. There's been times I've left out of there, and I was talking earlier, where I feel like I'm not even walking on the ground. I feel like my feet are floating. I feel like a weight is completely lifted off my shoulders. There are times that it's such a physical change in my body, and such a, it's almost like literally like a fog has been lifted off my brain when I come out of there. I feel like a different person sometimes.
Right.
Yeah.
Right.
It's really awesome.
It's amazing. Yeah. It's a good feeling.
Yeah.
And what's nice about it is that once we get those, that brain regulation, or we get the cells to behave the way they're supposed to, what we know from research is that condition is long-term. Mm-hmm. So beyond the 40 or 60 sessions, we've studied people 30 and now even 40 years post neurofeedback training, and their brain images are showing that the neurofeedback effects are still evident even after that length of a time. So it's really important for people to learn a lifestyle change throughout that program. So as long as a person is sleeping good, exercising, diet, those things are so important, and even relaxation. So those are the 4 things that we take for granted, that we don't really do enough for ourselves. So if we can maintain a healthy lifestyle, then we know that the effects of that neurofeedback are really good for a lifetime.
Yeah, that's awesome. That's so good to know. So Peggy is asking, what's the cost for the sessions? And I know that's going to depend on what clinic you go to and where you live, but can you give us a general idea?
You know what, Carmen, I don't have that information, unfortunately, but we can call the clinic because they sell packages. So there's 20 session packages, and then it includes a second brain map too, so that we can do a comparison. Yeah. So once a person comes in for the first one, then they would purchase a 20 session program that includes the 20 and then another brain map. So I apologize, I don't have that information. That's on the business side of the practice. So I don't have that information.
Yeah, the average, you guys, what I paid, I bought a bulk package of 25 when I started, and I got a little bit of a discount for doing that. And I think I paid 24 something hundred or something like that. I can't remember, but all of that was included. So, I'll say this, it didn't even seem, it went, the mapping and the sessions and all of that, you do them over time. So it wasn't like, I felt like I had gone for like 6 months with this treatment. I wasn't paying over and over again. It was long. I had, good long sessions and time in between. So the investment was well worth it. Linda is saying, to clarify on the number of databases, she asked this question earlier, do the practitioners or do many of them use the same database for the neurofeedback? So I think she's,
There-
what she might be asking is if she goes somewhere and has the mapping done, are they going to be able to, will they be able to cross-reference each other, I think is maybe what the question is.
A qualified clinician can cross-reference them. There are two main databases. One of them is the NewMind database, and the other one is the Thatcher, or what's called NeuroGuide. So
Okay.
those are the two most common. I'm sure there's little, cells out there that do their own databases, but those are the most used two.
Okay.
So they are interchangeable. Like I can read one, although I use the NewMind database, I can read a NeuroGuide database and get information from that. So like I said, somebody who's board certified is extremely important if you're going to look for a practitioner, because that ensures the highest quality, the highest credential in the field. So try to look for someone who's board certified, and they can do that.
Okay. Now, with this being, let's say if it is a doctor covered, like you get the codes and they say they're going to cover it, your insurance will cover some of the reimbursement or whatever. Does a doctor have to order that, or can a person initiate that on their own? Linda's asking.
They can initiate it on their own.
Yeah. Okay, good. All right. Another question by Linda. She's like our question girl. She teaches a form of neuro movement that remaps the brain in the sense of proprioception on the body. In the body. Can you give any insight as to how this correlates or complements or overlaps what you do? She loves the science of it.
Well, I think that they're both, again, if they're used in conjunction with the other. So the movement, if we do repetitive movement, we're going to start changing brain behavior, and we're going to build those new neurons by learning a new movement. So it's just like behavior modification. So if we do a behavior over and over and over again, eventually we're going to build new networks in our brain. So it just works from the inside out. When we're looking at neurofeedback, we're looking at changing the cellular structure of the brain that's going to translate into different behavior. So when we're using neurofeedback with occupational therapy or with physical therapy, those modalities are working from the outside in, and the neurofeedback is working from the inside out. So they complement each other. But what we do find is that working with the cellular structure is a lot quicker than behavior modification and movement modification.
Yeah. Yeah. Okay. So one of my questions is, when you do a brain map, can you see things like addiction or trauma? Like how do you identify those types of things? If we can move away a little bit from the ADHD and the ADD, those types of things, how do you see trauma? How do you see addiction on a map like that?
Okay, so addiction, if there's a predisposition, like a genetic disposition, we will see a low voltage condition. And that would be an under a 20 microvolt across all of the frequency bands. So that's what we would identify. What's nice about that is we can teach a person, if they have that predisposition, that they really need to be careful on what they engage in, because it's like playing Russian roulette. So it's more preventative. There are different drugs will present with different physiology in the brain. But we can look at that, it's individually. Now, what we know from the Center for Disease Control and some of the New York court systems that we've done research on the drug programs, we have a drug court here in New York, and we're finding the same exact statistics as the CDC is, and that 85% of people with addiction have some type of childhood trauma. And they call that adverse childhood experiences.
Right.
And so the higher score you get on that assessment for the adverse childhood experiences, the more at risk you are to develop. So it really makes sense, because we look at different models of addiction, and we look at the disease model. And so what we've really kind of got down to the nitty gritty is it's a disease, but the hyphen is in there where it's really a dis-ease. So there's something in the system that's broken. And most times that's from some kind of childhood trauma that cause us to seek the substance that's going to either take away the pain or deaden the pain for a little bit. And we've incorporated that in some of the New York drug courts here, because we're, the typical treatment is to treat the symptoms. So, but what's causing the symptoms? Again, we go back to that, the functional perspective. So if we can address the trauma, then the person is less likely to use. As far as physiology, we know when we have that predisposition, we're looking at a dopamine receptor deficit. And in some of the research, it's called an A1D2 receptor, which means that the body's producing dopamine, which is that feel-good hormone,
right?
But we don't have enough receptors. So if the receptors are not there, the dopamine goes into the synaptic gap, but it has nothing there to catch it and recycle it. So eventually the body says, well, I guess I don't need any. So it slows the production of that dopamine. Now, again, dopamine is the excitatory neurotransmitter, so it's the one that makes us feel good. So if we don't have enough of that, we're seeking an external excitement.
Right. Now,
so that's where we get that.
That's fascinating. So what is the fix for someone who has a dopamine receptor deficiency? How do you fix that? Is neurofeedback part of the
Yeah, exactly. And I feel like, like saying it all the time, but it's like, yes, neurofeedback can work for that, because what we do is we create new neurons and those create new receptors. So now we have a neuron that's really getting the messages from neuron to neuron and really producing that dopamine. So what we find is that as we're regulating brain activity, we're regulating the amount of dopamine and the cravings are less. Okay, and then we did here in our clinics in New York, we did a 4-year federal grant from the Office of Mental Hygiene, and we worked with addicts for multiple different substances. And we found that once we're helping them to reduce the anxiety, reduce the depression, help them to sleep better, all of those things that are triggers for them to relapse, if the triggers are not there anymore, they're less likely to engage in the substance. So the dopamine, when we don't have enough of it, we need to seek something.
Right.
So I'm sure all of us have experienced when I get my cup of coffee in the morning, wow, I feel good. It's that artificial production of dopamine. So it makes me feel good.
Right.
But as the caffeine wears out of my system, now I need more.
Right.
But if we have the proper amount of dopamine in the system, we don't have those cravings. So the cravings reduce.
Yeah, that's fascinating. I was listening to an interview with Tim Ferriss and Gabor Mate, who I love. I love Gabor. He's amazing in the field of trauma and addiction. He just, I don't know. I've watched everything I can by him, and he was talking about how how hard we are on ourselves and how we tell ourselves these same stories over and over again about with shame and guilt behind being addicted to things. And that, if you can turn that around, that thought process while you're doing other clinical and psychotherapy and things like that, you can turn it around and tell yourself that addiction actually served a purpose for you, for something in your life to help you survive. It can actually help you to rewire the brain in a different way, which is, I thought was fascinating. See, I'm fascinated by all this. I don't know. I'm kind of a geek like that when it comes to the brain.
Welcome to the club.
Welcome to the club. Yes. Yeah. Okay. So can you give us a little bit of a kind of a run through of what it looks like to walk in and get your brain mapped? What is a person, what would they experience?
Okay. First, what we would ask is to try to get a good night's sleep, refrain from any stimulant medications that include those Ritalin type things or sugar, caffeine, anything that's going to artificially elevate brain activity. It's typically done between 8 and noon because of the body's circadian rhythm. So we get the cleanest data between 8 and 12. Person comes in, they would get a sort of like a swimming cap, and the cap has electrodes that are strategically placed in the cap So when it sits over the head, it sits over the 19 major hubs of the brain. The technician will take those electrodes and fill them with conductive gel that helps to read that activity better. We do a 6-minute measure with your eyes open and then 6 minutes with your eyes closed. And that's all it takes to get that whole thing. You take the cap off, you wash the gel out of your hair, and within, a day or so, we can set you up for a consultation where we can come in and do the results.
Yeah. Yeah.
So it's really simple. 45 minutes,
Yeah. I have struggled with staying awake though. I have to admit, I'm a type AAA personality. So you put me in a chair in a dark room, and it doesn't matter if I've slept 12 hours the night before. I get so relaxed. It was so hard for me. I had to look at this bird on the wall to keep my eyes open this last night.
I remember you said that. That was funny.
Yeah. But it is very simple. It's not invasive. Just wear a hat when you go, and if you're a woman, because I looked like Pippi Longstocking when I left out of there that day with that gel sticking out everywhere.
Right. Right.
Yeah. Okay. So, so you have a clinic in New York. You have 2 clinics down here in Tennessee. How did you get involved with down here in the South? How did KK seek you out, or?
Yeah, actually, I'm a certified mentor, as you mentioned in the opening part there. So I'm recognized by the BCIA as a mentor. So people who are looking to get in the field have to do their clinical mentoring. So it's a certain amount of hours that are required, clinical supervision, hands-on, educational component and all that stuff. So KK was at the point where she needed a mentor, and I mentored her through that. So through that process of getting her BCIA certification. So that's how we met. She was, I guess, impressed by my knowledge in reading the QEEGs, where we started to do it just on a consultant type of basis, to the point where, she asked if I would come on as a full-time clinical director, which I was thrilled to be a part of it. And it's been really exciting. I was started back in February of this year, so I'm just newly the director, but it's been exciting. There's an awesome team. It's just amazing, the coherence between the team members. So I think we got something really good going on.
Oh, I would so agree. And, I had my first map read by someone else, and I left out of there with a lot of questions. And the fact that you were able to go in and read my last, what was going on my last map, and this one here, I was blown away by how accurate you were, and knowing what I was going through for each one of those maps, and how it was on. It was spot on what I was going through, and how much improvement we saw was very impressive. And I was talking about that earlier. It was true proof. And one of the things I was telling the coaches is that, sometimes people really need to see black and white that there's something wrong with them. And I used, high blood sugar as an example. Sometimes you can tell someone you really got to slow down on the sugar. You got to get some control of that. And they're like, no, I don't really have a problem. But then if you get a lab and it says your HbA1c is 6.5 or something, they might be a little bit more fearful. I feel like it's kind of, the same type of thing with this. If someone says, no, I don't think that's causing my problems, but then you can see how low your brain power is once you get your map. Oh my gosh. Like for me, I don't even know how I was functioning, to be honest with you. It was terrible.
Yeah.
But it was.
And for most people, it just helps them to connect those dots, so, I didn't realize I've been feeling this all along, and so it kind of helps them to understand why.
Yes.
And put those things, but then the encouragement that I can change this, and I can change the course of my life to meet a healthier lifestyle, better quality out of my life. So it's encouraging that way too, not only to identify the dysregulation, but we can help you regulate this. So you don't have to live with this the rest of your life. And another thing I want to add before we stop here is that there are many times that things go undiagnosed. So I can't tell you how many times that we will identify some type of brain injury. And when I ask somebody, they're like, oh yeah, I had 4 concussions, or I was in a car accident, or I played football and I was out on the field, unconscious like 4 times, But then we have behaviors and symptoms that we just addressing them, and we don't realize that why they happened. Why did I lose my memory all of a sudden? So we really uncover those things. And getting back to the addiction, there has been multiple times over the years that people with addiction, they don't know why these things are happening. They have this brain fog. They can't remember. It's so easy to engage in a substance and make me feel better, and I don't have to worry about all those things.
Yeah.
So many times, by us understanding that there is a brain trauma and we can address that trauma, again, it translates into less use.
Right. Absolutely. Okay. So speaking of trauma, and then we'll wrap up here. I ran into a door the other day. Oh, yes, I did, with my head. And it's actually, you can't see me right now, but anyone that's watching the webinar can see I've got this green bruise going on down into my eye. And I was scratching my eye earlier. I've got some sensations coming back in there. When I do my neurofeedback sessions without having to remap, is that going to go after any of the, maybe if I did any damage in there? Because I've got a slight headache that just kind of popped up today or late yesterday.
Yeah. So what in order to change any of those protocols, we would have to take another map, take another look and see. It typically takes about 3 to 6 months for a brain to what we call recover from an injury.
Mm-hmm.
And then from there, we can find out what the residual is, because the first 6 to 9 months, the brain is doing what it's going to do in order to try to heal itself.
Right.
So at that time frame is when we can say, okay, the smoke's cleared, and let's see what kind of, what's the residual from that injury.
Okay.
So I would wait a little bit.
So yeah. Okay.
Yeah, I would. Even 3 months would be fine. So they say anywhere from that 3 to 6 months is good.
Okay. Yeah, it was quite a hit, I will tell you. I had a hematoma on the front, and now it's bruised. It was pitch dark, and I was running through the house.
Boy.
Running late, that kind of thing. But anyway, I'm in good hands up at Tennessee Neurofeedback.
There you go.
Yeah, and just let me throw a couple of just reminders out there, you guys, that Tennessee Neurofeedback is in Brentwood, Nashville area. There are many, many people that have already gone in and done some intensives. I'm having people come in next week, and a couple of students are doing some intensives up there when they come in to see me. So if you want that information,
Carmen,
yep.
Midtown too. Mention the Midtown location.
Oh, that's right. Midtown. Well, it's closer for me to be in Midtown, but there are 2 locations. So you've got Brentwood and you've got Midtown. So 2 areas that you could actually choose from to do the intensive as well, depending on where you want to stay. And there's hotels and affordable things everywhere, and lots of great things to do in Nashville while you're here. So I just want to throw that out and remind you guys, let me know. If you come in town, I would love to come up and have coffee and meet with you as well. And I might even run into you while I'm in the middle of doing sessions. So Dr. Steffins, thank you so much for your time today and for sharing this valuable information.
Thank you so much for having me
and
sharing the information, Carmen. God bless you.
Yes. And one more thing I want to say, and on behalf of one of our veterans that's on right here, Stan, I want to say thank you for what you do for the veterans, because it is, so many people say, well, we can only do so much. Well, to be able to offer that pro bono service to them and for everything that they've done for us I want to say thank you for that. That's not a small thing.
Oh, you're welcome.
So appreciate it.
No, it's my pleasure to do it. Thank you for mentioning that. I appreciate it.
Absolutely. All right, everyone, have a wonderful weekend, and take care of yourselves and your brains. And thanks so much, Dr. Steffins. We'll talk to you later.
Okay, thank you. Bye-bye.
Bye-bye.